Applestosen. It's Dr. Bob here with another health and vitality tip of the week. Today's condition we're talking about are called migraines. Now, migraines are a debilitating problem that affect approximately 27 million people on a regular basis. So what are migraines? Migraines are classically a type of a headache that actually constricts blood vessels initially from some sort of stressors, and then as a protective mechanism it massively dilates the blood vessels, so then you start to get these hyperactive states. So you get hyperactive aspects to light, to certain sounds, certain smells. So all of your senses are intensified as you get this raging headache, where most people will go into a dark room, ice themselves, and sometimes be there for days. Some people just over-medicate themselves and take ibuprofen or other medications that might just mask over the symptoms. But you got to look at what the actual cause is. So we have literally 40, 50 patients in our office that are neonatal nurses, meaning that they work in a stressful situation in a hospital with premature babies, and they have to be on their feet long shifts, and several of them were having chronic migraines. And as we started to look at this, it was thread throughout a lot of these nurses that they would have these migraines that would hit them. And then they referred a couple of the doctors that are neonatal surgeons and also neonatal physicians that are on 24 to 36 hours on call at the hospital. So that much time without sleep, without stresses of the day, can actually cause stress on the nervous system. One of the doctors actually would inject themselves with Toradol, which is a very heavy pain reliever, just so they could function. So the reason I'm saying this is because a lot of these doctors and these nurses are now understanding how chiropractic can reduce stress on the nervous system and are getting adjustments regularly. So the upper cervical area was one of the most common areas. So if you look at the top two vertebrae, these nerves actually go and they supply a lot of the blood supply to the neck. They supply a lot of the circulation to and from the brain. And so if there's a problem with these areas, it can affect the respiration system, which reduces oxygen, which can trigger a migraine. People can sometimes hold their breaths, creates headaches, and it can actually create problems in the brain and visual centers. So migraines can be triggered by a lot of things. It can be triggered by chemicals. Some people have intolerance to methylxanthines in wines or in chocolates or certain processed cheeses. That can trigger migraine. Most of the time it's a stressful situation where a person's not getting enough rest, and this cycle keeps going on, and they trigger off this migraine. So making an adjustment to the area, to the upper cervical, to restore proper nerve supply is critical. Continually dropping your head forward puts a lot of stress on the area, can trigger migraine. That's a very bad stress on the uppermost part of the neck. So making sure that you're bringing your work up to where you're looking at your computer in front of you. If you're reading, you're not dropping your head forward. The other thing that we see that you can look at is people that have had car accidents or injuries. A lot of migraine sufferers have what's called a head shift. So if you look at their posture, their head is dramatically shifted off to one side. This triggers off this hyperactive nerve response. So you can look at your own posture. If you're a migraine sufferer and you see your head is shifted or tilted to one side in your normal posture, that needs to be brought back into proper alignment. Otherwise, these constant migraines will keep triggering. So get a spinal checkup, look at your posture. Why take medication throughout your entire life when you could potentially alleviate the effects with proper alignment and proper chiropractic care? This is another health and vitality tip of the week. So get a spinal checkup. Don't over-medicate, but just make sure that your body is functioning like it's supposed to, from above down and from the inside out. Until next time, it's Dr. Bob, Applestosen.